guys, it's Dr. Cynthia from the Barnegat location. I have patient Michelle with me. She's been coming in for a few weeks with neck and mid-back and low back pain. For her cervical neck, we have been working on her with adjustments, acupuncture, and active release technique. Today I'm going to be talking you through how to do a couple exercises for active release technique on the upper portion of the neck. Active release technique is used for soft tissue disorders. It kind of takes a muscle, shortens it, we put our thumb in there, you and the patient together will work through a range of motion, the original motion that muscle should go in, and it'll break up adhesions such as scar tissue and muscle knots, and those limit your range of motion and they limit your flexibility and cause pain and stiffness. So by doing the active release correctly, it will break up those adhesions and it will increase your range of motion and decrease pain. All right, so now that we're ready to go, we are going to start with the rhomboids. The rhomboids are around the back, connects to the transverse process into the medial border of your scapula. The rhomboid is responsible for elevating that shoulder and protracting it. So we're going to find a point in between there. I'm gonna have Michelle take her arm out, and I'm gonna have her bring this arm straight across your body as far as it'll go. Hold for a couple seconds and then come on back, okay? So you wanna find pressure points and dig in. You go ahead, you can go with that arm. You wanna do at least 3 to 5 passes. Bring it back for me. And you can feel underneath where the muscle is kind of straining under your hand, where you might feel those knots and adhesions. Bring it back for me. And then do one more. Perfect. And then you would also do this bilaterally. Okay, you come this side for me. Bring that arm back out. And bring it across. Good. Bring it back out. And then do one more. Perfect. The next one that we're gonna do with Michelle is gonna be the levator scap and the upper trap one. So I'm gonna have Michelle bring her arm up. So the upper trap and the levator scap connect to the transverse processes and to the medial border of the scapula as well as the rhomboids. What this does is it elevates the scapula up. So when this is tight, it kind of pulls down the neck a little bit, might give you a headache, neck pain, something like that. So I'm gonna dig into, again, another pressure point on here. I'm gonna have Michelle look up towards her hand. I'm gonna have her bring it down to the opposite hip, follow with her head while I'm putting some pressure in here. Hold it for 2 to 3 seconds at the end and then bring it back up top. Okay. And again, we're gonna do this for 3 to 5 passes. Go ahead for me. Good. You also want to make sure that you're moving around, not staying on the same spot. Bring it back up, and one more. Good. Okay, you feel that? So the final muscle that we're going to be performing ART on with Michelle today is going to be the scalenes. The scalenes are responsible for lifting up that first rib, but other than that, as far as the neck goes, it's responsible for flexing and bending to the same side as that scalene. So for this one, I'm going to have Michelle bring her ear to her shoulder on the same side, and I'm going to put some pressure down in here, so bring that ear to that shoulder. Okay, I'm gonna apply pressure downward, and I want you to pull away slowly to the opposite side. And hold for a few seconds. Good, come on back. Bring that ear to that shoulder again. I'm gonna find a new spot, bring it on back the opposite way again. Hold for a few seconds. And one more time. All right, I hope you enjoyed our presentation on how to do a couple of ART moves for neck pain, shoulder pain, upper back pain with Michelle here. Just so you know, you can, if you're having any problems that are similar to this or think that any type of ART move can work on you, because there is also other ones for the lower half, extremities, things like that. If you or anybody that you know would like to come in and maybe ask one of your providers about it, or kind of explore it a little bit more with someone within a Thompson facility. We also do pride ourselves on most of our providers being ART certified, so that is always an option for you when you come in. Thank you and have a good day.